Hi, I'm Dr. Bruce Moskowitz from Specialty Aesthetic Surgery. I'm an oculoplastic surgeon, and I'd like to talk to you a little bit about Botox today, myths and misconceptions about it. I've been doing Botox for over 31 years now. I was one of the early adopters, lucky enough to have Botox available to me during my fellowship, where we treated hundreds of patients with movement disorders. And we learned very early on, probably in the early 90s, that it worked extremely well for wrinkles. People have a lot of misconceptions about Botox. The first of which is that it's permanent and that the side effect profiles will last forever. Nothing, as you probably know, could be further from the truth. Botox has a temporary effect, which can last a number of months, but always goes away. The way the medication works is it works at the end of your nerve terminals, where chemicals are transmitted to the muscles. It inhibits that, and these nerve terminal endings atrophy, shrink away. As the Botox wears off, new sprouting of the nerve terminals end, and muscular action begins again. And that's in everybody without exception. The second misconception is resistance. I've been doing this for a very long time, have done tens of thousands of treatments for thousands of patients, and I have to tell you, I've never seen resistance as a problem, where antibodies form to the toxin and make inactivated, so to speak. That's never been my experience with it, and I've yet to see a patient who truly had resistance. Another misconception about Botox is that it can lift tissue. In fact, if you know anything about the mechanism of Botox, it actually inhibits muscular contraction, so it cannot truly lift any tissue. What we have to use Botox as a tool in our armamentarium of many different techniques, both surgical, non-surgical. It's not a filler, it does not add volume, but what it does is that to dynamic movement in the wrinkles that cause it, it can diminish those wrinkles. It can have a lifting effect by inactivating the antagonist muscles to a particular body part. To give you an example, in the forehead and the eyebrows, if you give Botox straight across the brow and you inhibit the muscles that lift in order to get rid of these horizontal lines, you can actually make the brows look worse and make them come down because you've inhibited the movement of the lifting muscle. Whereas what we really should be doing to get rid of the forehead lines is first to get rid of the muscles that pull the brow down and in, the glabellar muscles and the lateral orbicularis muscles, which pull the brow down and in. If we inhibit those muscles, the lifting muscle can work unopposed. As most surgeons understand, there's a balance between these antagonist and agonist muscles, which give a balance. They're always working, both groups of muscles. And if we inhibit one, it allows the other one to work more easily and diminishes wrinkles. In our practice, what we do is we often go after these antagonist muscles along the glabella and along the forehead to raise the brow. And if there are any residual lines over here, we can give them very minute doses of Botox at 2 weeks later when it's at its peak to diminish those and give a great aesthetic outcome.